Thank you so much for coming. I really appreciate each and everyone that has come here. So before I get into my presentation, I'm just going to talk a bit about BMC, the history of BMC and how we started. So BMC was founded in 2013 by myself and another medical doctor. His name was Dr. Anjum. So we started it, and our vision was to offer a wholesome patient care, because we believed that and we still believe that human life is sacred. So when we founded BMC, because we're just in Belvedere, we are surrounded by so many schools, because I think just in this vicinity alone, we've got Tel 1 Learning Center, we've got Belvedere Teachers College, we've got ZESA as well, Training Center. So we had a lot of schools that were also surrounding us. So as we were doing BMC, so in 2013, it was just an accident emergency. And then in 2017, we then opened up an X-ray facilities, laboratory, ambulance. And, because we're in the community, we're able to even engage with our patients. And some of the things that came through our engagement was there was also need to have a medical aid, because the patients were complaining that sometimes they couldn't afford to pay cash all the time. So we then launched the medical aid, which is Savelife Medical Aid. So the basic idea with Savelife Medical Aid is, instead of patients paying cash each time that they come to the visit, they can actually be on a subscription-based model. And then we then expanded that to also come and to also be applicable in terms of our schools that are surrounding us. So we can do the next slide. So from our experience in this Belvedere community and the schools that are surrounding us, we realized that there was a need in schools. And the need came because schools at times can have 300, 500 or 700 students in one place. So there is definitely a need for some sort of medical facility, because anything can happen and at any time. And a lot of the times when the students are coming to school, the parent might have paid their medical aid or whatever, but when there is a problem and you now want to help that child, you then realize that that medical aid is not working. And a lot of the times, the schools would actually come and say, you know what, please, can you treat these patients, these children for us? They would actually foot the bill. And this was happening a lot. So that was one of the needs that we understood. And then also, there are now high impact sporting activities. Like kids these days, they are very competitive. I think now we've got extremes. So we've got kids that are not active, and we have kids that are very active. So for the kids that are very, very active, there is also a high incidence of injuries, because these kids are playing rugby, all these sports, and the sports guys are so competitive. It's like you're watching professionals. But if you have ever noticed, each time that there are professional sports being played, there is always something in terms of health that is prepared. Like if you're like me and you watch football, those guys are very serious about injuries, because they understand that the management that can occur within the first few minutes of an injury can have a big impact on the recovery. So we also have high incidence of NCDs. So these are non-communicable diseases. So as I said, we have extreme cases. So we have some kids that are very active, but we have some kids that are not so active. So because of that, we are finding that some children are actually presenting with diabetes and these diseases that are more of that you would expect in older people. And some kids are actually obese these days. So there are also some health challenges with that as well. And these days, because of COVID, I think we saw during our COVID pandemic that we also have communicable diseases. You can have a flu or an influenza that can actually affect the whole school and actually disrupt lessons. We have things like typhoid that are actually happening all the time, where one child has a diarrhea and tomorrow the whole school has got diarrhea as well. So basically, this is our understanding of the need. And then we also have the regular everyday ailments that can actually just occur where people are. So that's our understanding of the need. And let's go to the next slide. So our solution was to set up school-based healthcare centers, like the one that we have set up here. I think we'll have a chance to go and view the setup that we've done here. So these centers are not, they are actually at the school. And we provide in the center, there is equipment there are drugs, there are facilities, so that when a child is at school, if they've got an emergency, it can be taken care of immediately at the actual school. And if they have non-emergency things like the child has got a headache, whatever it is, they can still go into the clinic, they can still be assisted. So there's no need to be calling the parent all the time. And then this also helps us to actually kind of gauge to say, is this something that is serious, that needs further attention, or this is something that can be actually handled at the school? And so the clinics are normally open 8 Monday to Friday, 8 hours a day. But at times we can actually open them during the weekend, just depending on the school and the particular requirements of that school. So we always have a nurse available. We also always have a doctor available on call in case it's needed. Sometimes the doctor is booked in and he can actually come and assess, and then we also have an ambulance cover available 24 hours as well, in case the child needs to be evacuated from the school to go to our main center, which is our 24-hour center. So basically all the emergencies, the initial management we do at the school, but then we're able to transport the patient from the school to the hospital depending on the need. And then I think the last point there, it talks about food handlers examination. So at schools, if you've got a boarding facility, you can have a kitchen or people that are preparing food for the kids. So as part of the services that we offer, we are actually able to do food handlers examinations. So for all the kitchen staff or anyone who's going to be in contact with food, we can actually screen them to see if they've got some communicable diseases, and this will actually prevent outbreaks. We also do swabbing and testing of the surfaces and things like that, so that the parents can also feel secure to say, hey, you know what, our school is so concerned about the health. So I think that's what I was talking about. I think we can go to the next slide. Yeah, okay, sorry. So the benefits, I think those are the benefits. So we've got unlimited consultations. So the child can come to the clinic as many times as they want or as needed. So there are unlimited consultations. So the students, they access emergency ambulance services as required by the school. So we don't have a limit to say you've had 10 emergencies, so we're not sending the ambulance. So the ambulance is there, it comes. If you've got sporting events, we would love to actually cover those events, because we believe that when an injury occurs, if you can treat it there and then, it can actually reduce complications in future. And then the students also have an access to laboratory tests.
Afternoon, my name is Makai Tamtetwa and I'm in Upper 6 Physics from Samuel Centenary. We're here at BMC to learn about the practical part of our syllabus in the medical physics.
The reason why we actually came here, we've done the theory aspect of it, so now we're here for the practical assessment and to see how it actually works in our day-to-day lives. So we're here at Belvedere Medical Center to be brought to and taken exactly how everything happens. And BMC also provides our medical aid there at Samuel Centenary. So
we want to see their services as well, how they operate and get a more understanding of what we've been learning and where our patients are being taken and if they are getting good care or not.
We're back again from the tour and we learned a lot of things about x-rays. We learned about the x-ray cassette, which capture the information inside the body and then it's transformed into the physical report for the x-ray disc.
I saw the x-ray machines, one which is the x-ray disc, which displays the information after taking an x-ray on a person's body.
We've learned a lot and we're motivated and we can't wait to learn even more.
It's going to help us as well, like when you're going to write down our theory part. And yeah, so we are enjoying, honestly. Thank you.
So we've got a laboratory at BMC. So basically, when the kids and the doctor sees the child, they've got access to laboratory tests, and we can test these things. 24-hour service, yes, to come to our clinic, they can come as well. And then we've got x-rays, access to prescriptions, so these ones will obviously have some of those limits. And the other interesting thing that we also introduced, especially at Savelife Centenary, we also introduced first aid training. So remember, we are putting a clinic, we've got a nurse, we've got a doctor, but we also thought, let's also empower the student. So the students can actually be trained for first aid. So within their dormitories, within their classes, they've got class prefects or whoever is there can actually attend to emergencies as well. So we also train the students on first aid as well. So the next slide. So basically, let's say you are interested in the process. I'm just going to give you like a brief summary of how the process would come, where we would be able to set up the school. So basically, I think the first step is to have an agreement, and then after that, what we only need is 3 rooms, where we need a reception, we need the doctor's consulting room, and then we need a treatment room that we use as well as for observations. And then we need to make sure that the rooms that, like the doctors and the consulting or treatment room, they need to have like sinks in there so that people can wash their hands. And then we also need an outside area where we can actually dispose the medical waste. So we don't want kids to be playing in that area where there's medical waste. So we need like a cage that is done there. And then we also need a wheelchair access in case we need for wheelchairs and things like that. So basically, on this, all we need is just a room with those requirements. And the process normally takes us 1 month to get permission from the local authority. So if it's Harare, it will be City of Harare. If it's outside Harare, there will be other authorities there. And then it can take us 1 month or maybe 2 for the Medical and Dental Practitioners Council of Zimbabwe to also approve our application. And then after that, it takes another month or so for the Health Professions Authority to actually approve. So minimum can be 3 months to set up if everything is lined up quickly, or it can take even 6 months depending on, because sometimes these meetings, they have like a meeting once a month. So if you submit your application after they've had the meeting, you now have to wait for the next month. So in summary, this is the process of registering a school. So I have some success stories here that I would like to just share. So at WUA, I think one of the first time when we established the clinic, we had a child who had WUA, that's Women's University. So we had a child who had a severe asthmatic attack, and this was at campus. And you know where WUA is? It's down there. So in the clinic, the nurse was there, the doctor was there as well, and they were able to actually nebulize the patient. And the ambulance came through, we transferred the patient, and then they got further assistance at St. Anne's. But for us, it was one of those success stories because if that facility was not there, it could have been disastrous because it was a severe asthmatic attack. And we also have another, I think we can go back. Okay. So we also had another case where, during these flu seasons, so when we set up a clinic, you're not anticipating that everyone will be sick one time. So it was about June, and I think it was actually a year. And then, all the kids, they were getting flus. And we actually had to send a doctor here and actually do the treatments at the school. But this was such a bad outbreak, and I think we were coming from COVID. So the school was able to continue operating, and we were able to actually assist all the students, and it didn't disrupt their lessons and things like that. And there was really no need to be calling parents all the time, in case you get severe cases, but we managed that. And then also the diarrheal case as well. We had a diarrheal case outbreak, and we're able to come swab all the surfaces, test all the employees in terms of typhoid and things like that. And we actually contained that outbreak. And we also did the necessary reporting that happens for that. And then some of the other cases was testicular torsion. So I don't know if you know this, but young kids, especially that are active in sports, they can actually get a condition whereby the testicle can actually twist, and that is considered a medical emergency, because if it's not rectified, that testicle can actually be, it won't work anymore. So we had 2 kids that were like that. They were seen here. They were actually able to be quickly diagnosed, and then they were able to go for theater. And 2 of them we managed to save, we managed to save them. Then the one, it was a late presentation, so the testicle had to be removed. But still, I'm sure they'll still be able to reproduce though. So I'm just trying to just give an example of how these things can actually help. So I think over the years we've had some sporting events where several kids can have injuries, and in one case we had like 15 children, because I think sometimes schools have like some tournaments where there are several schools. So in one of these events we had 15 children that either had an injury, collapsed, but we were able to actually assist them, and it wasn't a burden on the school because there was already an agreement, and our ambulance would also be able to assist there. So we have had numerous fractures and things like that. And just yesterday, as I was preparing for this meeting, I went to the clinic here at Samuel Centenary, and in there, there's a child in there who's writing exams. So this child started having an illness where they would be getting fitting. So they needed to write an exam in a hospital environment. And it was actually done here. So I was so impressed, because I was thinking that if we didn't have a clinic here, then it means they would have to send that child to another place and then to try and get that place accredited and all that. But this child, in this case, is actually able to write their exams at the comfort of their school. So I've got some examples here that I want Precious to play. I just want you to hear what other heads are saying about the product. I also want you to hear even what some of the global trends that are now there.
Hi, my name is Zero, and I'm a student here at Samuel Centenary Academy. And here at our school, we have our very own clinic, courtesy of Belvedere Medical Center, and they're always present to aid and assist whenever students are feeling unwell or they are medical emergency.
Not only do they have a center at the school, but then they also provide first aid courses that equip us, the students, with essential life-saving skills and knowledge to respond effectively in times of emergencies. By fostering a culture of preparedness and care, the center aims to enhance the well-being of all the students and the broader community.
Belvedere Medical Center also assists us with several other things, including ambulance coverage. Ambulances are provided during school functions and events, but mainly during sporting activities. During sports days, you'll always find a BMC ambulance on the ground or near any sporting activity area to take anybody to the hospital in case of a severe or fatal injury.
I want to share some great news about our medical aid program, Save Life, that we have here at Samuel Centenary. With Save Life, we can get immediate medical care during emergencies without the need of contacting our parents. The program offers vital services like consultations, admissions, and medical coverage.
Hello there, I'm here to enlighten you of the benefits of having BMC here at Simba Makuni Academy. Number 1, reduced absence. Number 2, immediate health care. Number 3, mental health support. Nothing less from BMC. What more would you ask for?
It is a private school that offers Cambridge, and it was established in 2017, and currently we have students more than 750. So it's a boarding school. So as a school, we are entrusted by parents to take care of learners, and we act in loco parentis in the absence of the parent, which means we are more or less parents for these students. So being a parent means you need to offer or issue everything that the students would require, or that any child would require, from academic, extracurricular, and above all, the health facility of any student is of importance. So to cater for the health facility of any student, we have opened a clinic in partnership with Belvedere Medical Center, where each and every student is contributing only $20 per term to cater for all the medical facilities or issues pertaining the learner, from the general first aid to x-ray and everything that pertains the health care of students. Why do we need health care at any educational facility? It is because parents will be far away looking for school fees, doing other businesses. So if there's any problem that deals with any form of disease at Simba Makuni Academy, it will be very easy for us to take care of these learners at the school using our clinic in partnership with the Belvedere Medical Center. With the Belvedere Medical Center, they give us a comprehensive medical assurance or medical care for our own learners. They provide us with the nurse, the doctors, and even an ambulance during sporting activities. So we are more than happy to partner with the Belvedere Medical Center. And if we are to grow any other school or else establish any other school nearby, we are going to continue with the Belvedere Medical Center. It's a health facility that every school or every institution must partner with because of its services. Thank you.
My name is Dennis Takaza. I'm the principal of Lord Byron College, which is situated in Nyabira, about 32 kilometers away from the CBD of Harare. At this point in time, I'm excited to announce that Lord Byron College has partnered with Savelife Medical Aid, which is a subsidiary of Belvedere Medical Center. The exciting news is that every student at Lord Byron College is covered under this initiative, which was initiated by our directors. And the beauty of it is that Savelife Medical Aid provides a rapid medical response to the students in the case of any medical challenge that might befall the learner at school and also at home. And then also it covers all the costs that are incurred when the child is being attended to. And at Lord Byron College, we're also excited because the BMC, through Savelife Medical Aid, have established a medical clinic at Lord Byron College, which takes care of the medical issues of all the learners and staff at Lord Byron College. There's also another advantage that I am excited about, because they offer ambulance services during all the events that happen at Lord Byron College, and also when you go out there as a school. A benefit for the parents as well, because they have got a Flex e-health system, which helps the parents to track the health issues of the learners even when they're at school and when they're at home. So there's no need for them to be in a hurry to come to school when the kid has got a problem. They can actually go on the internet and then log in and then track all the health issues that are happening to the learner. There's also another benefit why we have partnered with Savelife Medical Aid. They also offer wellness days, whereby they give the opportunity to all the parents to come in and then get some medical checkups. They also bring in different medical professions into the system that we've already on the Wellness Day. And then also through their clinic Bomanje, this is for the learners. And then because It offers sexual reproductive health lessons and also drug and substance abuse, and then also other issues that have to do with the students at school. And this will actually help the learner become a complete human being at home and also at school. And then Savelife, there's one facet which most of the medical aid services do not offer. They also offer the spiritual health, because they've got a chaplains department. In the event that the medical side is not assisting the child, then we can go spiritual. There were the chaplains, there were the trained pastors that can actually come in and then do some prayers with the learners. Because Low Burden College, we are a Christian environment, and then we are also excited to be part of the medical aid, Savelife Medical Aid system. Ladies and gentlemen, at this particular moment, think health, think Savelife Medical Aid. Thank you.
Hello guys, my name is Mr. Tai, and my students call me Miss Ru. I'm the head at Samuel Centenary Junior School, the new baby in town. We recently opened in January 2024, and we were proud to have 100% pass rate at Cambridge. We're still enrolling. You can come in. We both have day scholars and boarders, and it's quite a convenient when you are partners with the BMC, where we have the medical aid called Savelife. Guys, this is a bomb. Go and register and try it now. When you partner with them, they will bring the hospital to you. Guys, we have a clinic at our school, Samuel Centenary, where the nurses and the doctors are giving us a visit to see if our children have a problem. So before we run to BMC, we are here with them 24/7. You know, at Samuel Centenary, we love sporting. Sporting is one of our cultures. We are always having activities, making sure we are connected like the 21st century school. Anyway, they bring their ambulance from 7:30. If you want them at 6 o'clock, they will be here 7:30 till you drop. So that if you have any emergencies, if there are any problems that are occurring, they are here to pat your back. I love this medical aid. Please, let's go try it. So, ladies and gentlemen, my fellow schools out there, fellow parents and fellow teachers, let's go and try the BMC Medical Aid Cover Savelife, where they come to you at your doorstep with their nurses 24/7, patting your back. If you go to the BMC hospital, when there is need for admission, there you are going to pay no consultation, no admission fee, no medication. Everything is covered. When you have spots, they have your back because the ambulance is there for you 24/7. Try BMC. It's the best deal in town so far. And you'll thank me later.
And then when you come inside, it says, hello, hi, how are you? Hello. Yes, hi, how are you? So inside here, so we've got some observation beds. So basically, you know, we've got our nurse aid. I think when the patients come in, they're first, you do the vitals and blood pressure, temperature, things like that. And then afterwards, I'll show you the consulting room. You know, so when a child is not well, they can just come and be admitted here, and then they are treated here. So sometimes the doctor can actually come here to treat the child, or sometimes we can move the patient. And I think the examination thing, I think I was showing you this. You can see there's a desk in here, and you can actually see that there was a child actually writing the exam in here. As I had mentioned, okay. Yes, he had the child had some seizure disorders, so they could have fits anytime. So instead of them having to defer examinations, they were still able to write the examination here under observation as well. So I mean that's what we're doing here. So I saw this happened last week, and then the parent was calling me to say, please, can you do that? And I said, look, it's fine. It's not even a problem. Even if the child had a serious challenge, we would still be able to transport them to BMC. But the child said, I want to write my exam. Yeah. And I didn't mention, so we've got an electronic system here. So on my phone, like this, I've got an app. So it's called FlexiDoc. So this app, we developed it locally, because we're also into software development. So basically at the center or any of our clinics, all the patients that are actually seen, all the information is in an application, is in an IT system. So the advantage of that is the parent doesn't even have to call us. They can just log on from wherever they are, and they can see that my child was treated and this was the treatment that was given. When the child goes back on holiday to their usual doctor, the records are on the phone. So that's the other innovation that we have. So we've also recently launched the FlexiDoc app. And the idea is, when the child comes in grade 1 to form 6 or whatever, that child, the record is all in one place. So that's the FlexiDoc app. So we can just go to the consulting room. Okay. So knock knock. Hi sister, how are you? So Tinema visitors, you can come through. Okay. So that's our, if you can see the computer there, that's our software system. So everything is electronic. So you won't find like you used to find in doctors' rooms where there are shelves, and then when you come, they try and look for it, and then they are writing, scribbling, and things like that. So the nurse is here all the time, and then the doctor comes as and when required. But also, we are also going to develop the system further to also allow teleconsultations, because now even the government or the system in our country is now permitted. So sometimes instead of even the doctor coming here physically, because we've got a computer, they can even do that consultation remotely. But then the nurse, at any time, she can actually be in contact with the doctor, and they can actually make a treatment plan and treat patients. So maybe sister, you can tell us what you are doing or what you do, how you are finding it, and you can just show us the place. So this is the mic.
How are you? So I'm Sister Mapumo. I'm the nurse here at Samuel Centenary. So we cater for the primary and the high school. This is a 3-bedded clinic, which means we also observe our patients. We do history taking here. That means we do patient screening. We do the vitals. We also attend to emergency and cold cases. But for those cases that requires the doctor's attention, like the doctor was saying, we call BMC, and sometimes the doctors comes here or we send the patients there. If it is an emergency, we use the ambulance. I'm sure you saw one there. Yes. We call the ambulance, it comes and picks the child here, or sometimes we use the school transport to ferry the child to BMC.